Hi, in this lecture we will learn about who is Milton Erickson in relation to the strategic family therapy. As I mentioned in the previous part of the lecture that the therapy was developed from the work of Milton Erickson, who was one of the world's leading hypnotists and psychiatrists. Because of that, Milton Erickson is considered as the father of strategic therapy, as the therapy was largely influenced by the unique therapeutic approach of him. Erickson was a psychiatrist who specialized in hypnosis. His work with hypnosis was learnt directly from Freud's early findings of psychoanalytic approach. However, he perceived that the traditional psychoanalytic techniques, although effective but very much time-consuming. Psychoanalytic can take months or even years to resolve. Erickson wanted a faster-moving approach. Erickson believed that within one's consciousness, everyone has the power to heal himself or herself, and he used some quite revolutionary techniques to facilitate the client's acknowledgement of these resources. He was a founder president of the American Society for Clinical Hypnosis. He was a fellow of the American Psychiatric Association and also a fellow of the American Psychological Association. Interestingly, Erickson was a colorblind and dyslexic. He suffered from polio at the age of 17. There was an interesting story. The doctor did not expect him to live due to the severity of his condition. He got so angry and determined to prove that the diagnosis was wrong. He went into a state of auto-hypnosis. He paralyzed except for his hearing and the movement of his eyes. He became observer of people and he developed post-polio syndrome and was confined to a wheelchair. Erickson achieved his objectives in therapy by applying 3 procedures. The first one is accepting and emphasizing the positive. He identified and framed all symptoms and maladaptive behaviors as helpful. Now, when we say symptoms, what does that mean from the strategic therapy perspective? The symptoms are the causes of the family's current problems. Symptoms are problems. In strategic family therapy, the problems of the clients stem not from their family's behaviors toward the client, but it is the symptoms of the family that need to be addressed and corrected. The term symptom is the repetitive sequence that keeps the problem going. The second procedure he applied was using indirect and also directive approach. His interventions usually take the form of directives about something that family members are to do. The last procedure he applied was encouraging or directing routine behaviors to his clients. Erickson believed in utilizing the resources of his client and designing a strategy for each specific problem. He worked with his clients to help them become active in assisting themselves. He gave them directives and indirect suggestions throughout the process. His aim was to get the clients taking some actions in order to produce beneficial results, regardless of the clients gaining insight or not. In other words, the ability of the clients to get an insight is no longer important for him as long as the clients manage to do some changing in his life to resolve his issue.